So we'll go ahead and get started. Welcome, everyone. I'm Swapna Reddy. I'm Clinical Associate Professor here at Arizona State University's College of Health Solutions. I'm also an adjunct professor at the Mayo Clinic, Alex School of Medicine, and my areas of research and scholarship and just overall interests are in health policy, health disparities, and equity, specifically how the law and policy can be used as a tool to improve the health outcomes of specifically women, children, and working families. And I wear a hat over at Arizona PBS as well. I'd like to thank you for joining our Health Talks webinar brought to you by the College of Health Solutions at ASU. Our college works to address the challenges facing people and communities to stay healthy, improve health, and manage chronic disease. These Health Talks are one way that we serve the community with timely and relevant educational information that also provides continuing education credit at no cost. One note about next month's webinar, however, the Health Talks webinar being held on March 16th will not be eligible for continuing education credit. And that's really applicable only to the March 16th session only. But we hope that you join us anyway. And now for a quick housekeeping items. First, the session is being recorded and it will be posted at our website, which is at asuhealthtalks.com. Second, after the panelists have presented, I'll moderate a Q&A session. So hope to have lots of good kind of questions and comments ready to go. Make sure that you post those though in the Q&A box and not the chat box so that we see all of those great questions. And finally, you'll receive a brief survey asking for your input after today's webinar. It really helps us out. I hope you take some time to fill it out. If you're requesting continuing education credits, this has to be completed in order to receive the credit. So if you did not apply for CEUs, we would still appreciate your feedback to improve our series. It means a lot to us and we take the feedback very seriously. So without further ado, let's get going on today's very relevant and very important topic, health policy in Arizona, a lane for health professionals. Joining me today are Dr. Charlton Wilson, and I'll tell you a little bit about Dr. Wilson, although I'm sure that my description won't do him proper service. He's an independent consultant who helps healthcare organizations thrive and improve the health of the communities they serve. He's served on numerous community boards and is a clinical assistant professor in the Department of Internal Medicine at the University of Arizona College of Medicine, Phoenix. He's also a 21-22 Robert Wood Johnson Foundation Health Policy Fellow, where he served on the U.S. House of Representatives Committee on Energy and Commerce, and also served as a commissioned officer with the U.S. Public Health Service. In addition to clinical care, Dr. Wilson served in hospital leadership positions and developed programs in disease management and performance measurement that advance the mission of the Indian Health Service. Welcome, Dr. Wilson. Dr. Wilson will be followed by Dr. Amish Shah. Dr. Shah is a member of the Arizona House of Representatives. He served Central Phoenix and South Scottsdale. After Northwestern University Medical School, Dr. Shah worked for the LEK Consulting and completed an MPH at the University of California, Berkeley, followed by residency training in emergency medicine at New York City's busiest Level 1 trauma center. Dr. Shah taught medical students and residents at the Mount Sinai Medical Center in New York as a full-time faculty member and academic researcher. While there, he also led the New York Jets airway management team and is currently board certified in emergency medicine and sports medicine and practices throughout the state of Arizona. Since 2019, he added a different hat, which is that he became a member of the Arizona House of Representatives, serving Central Phoenix and South Scottsdale. He's been the recipient of several awards for the quality of his service, including the Arizona Capital Times Best Political Rising Star for 2 consecutive years, the Arizona Medical Association's Distinguished Community Service Award, and the Humane Society's Legislator of the Year. He's a recipient of the 2022 Legislator of the Year Women's Health Champion Award from the American College of Obstetrics and Gynecology. And important to note that he is the only physician in the Arizona House of Representatives and I believe Arizona Senate. So thank you and welcome to these wonderful panelists today. I'm so excited to have this fantastic conversation. So I think first we'll both say that we're so fortunate to have these health experts today as we explore health policy in Arizona, a lane for healthcare professionals. And we called it a lane for healthcare professionals because lots of folks in healthcare want to get involved in health policy, feel passionate about it, and will always ask the question, but is this my lane? And I think what the panelists today will share with you and what we'll discuss kind of further is, yeah, it's totally your lane. You should jump on in and we'll talk about how exactly to do that. So So how do new policies in Arizona come to be? What are the outcomes, both positive and negative, for Arizonans? We'll discuss the process of creating new health policies at the state level from inception to passage, and examine the effect that new policies have on health equity, health coverage, and health practices across Arizona. Our first presenter, as I mentioned, is the very impressive Dr. Charlton Wilson. Dr. Wilson will present Health Policy in Arizona, a Lane for Healthcare Professionals.
Great. Well, thank you, Dr. Reddy, and welcome everybody for coming today. I'm going to take just a moment and share my screen. And we'll get that started. How does that looking? Very good. Well, thank you. Well, I'm here to share my story. And that story starts a long time ago in an emergency department late one night. I was there to admit a couple of patients from the local neighborhood. One of them was an older woman, and I'll call her Mrs. Smith. And she was there experiencing a stroke and chronic kidney disease as a result of untreated hypertension. And the other person at the exact same time was a young man, I'll call him Anthony. And he was there with some chronic complications of wounds that began after paralysis, which was the result of a gunshot wound several years earlier. And it was a busy night. The emergency room was very chaotic, and I began my work of, what I do as a young resident at the time, applying my medical knowledge to try to help them. But in that busy area, I sort of came to recognize that they also needed something else from me. Mrs. Smith needed help with health insurance in order to be able to pay for her medications to treat her blood pressure condition, which, if she had done so, might have even prevented the entire episode that night. And Anthony needed assistance getting access to services that might have helped change his situation, and maybe not change the situation, but helped him adapt to very difficult life circumstances. And maybe those things might have helped prevent him from being in that awful accident that evening several years earlier. Well, I didn't know exactly what that I needed to do for them, but I quietly made them a promise that I would fix this. Well, the events of that evening and over the years eventually led me to, as Dr. Reddy shared some of my background, to be a commissioned officer in the Public Health Service, working in the Indian Health Service. And then after that, I was the Chief Medical Officer of Mercy Care, a health plan that served Medicaid and dual eligible beneficiaries in the state of Arizona. And over those years, even though I was extremely proud of all the work that I did with my colleagues and the ways we were able to help people with access and affordability, I still knew that I could not completely say to Mrs. Smith or Anthony that I had fixed the problem. And that led me to apply and be fortunate enough to be selected as a 2021-2022 Robert Wood Johnson Health Policy Fellow. Here I am with my colleagues in my cohort of other physicians, nurses, and an attorney. They became not only colleagues, but really great friends. The fellowship has really two components, one of which is called the orientation, although it lasts all year long. But it's a time where in sort of small groups, we meet with health policy leaders, such as the head of the FDA or other agencies, and throughout HHS, CDC, and other programs. We visit various places around the Washington, D.C. area. And we also have opportunities to go on field trips. And some of our field trips included the legislature and departments of health in the state of New York. There we are in Albany. And then a really great experience of traveling to Puerto Rico to visit with their health department and their leadership to understand the very unique aspects of health and other societal issues in that territory of over 3 million United States citizens. The other part of the fellowship is a work experience, is an immersion work experience. This is where I spent the entire calendar year of 2022. Work experience is exactly what you might think of like. I commuted to work. I went to happy hours and had birthday parties with my work colleagues. And I had a desk with a computer and a couple of monitors. But there's a few things that are really interesting about that work experience as well. How many workplaces have a television on their monitor desk there where whether it's news or other hearings are happening all day long, and you're constantly looking for information and what people are thinking out there. And of course, the building is pretty nice. The library was started by Thomas Jefferson. And occasionally you have to go around the corner a little bit because there's a breaking decision at the Supreme Court. So there's always something that makes it a really unique work experience. As Dr. Reddy mentioned, I had the great privilege of being on the working in the United States House of Representatives on the Committee on Energy and Commerce. People sometimes wonder, what is it about energy and commerce? Well, that Commerce Clause covers a lot of ground. And in particular, the jurisdiction of the Energy and Commerce Committee includes all of public health legislation, as well as all of Medicaid, and shares responsibility for Medicare with Ways and Means. The Senate is a little bit different in their jurisdiction, so each place is different, but it's a really great committee to work on from the standpoint of the breadth of health policy issues that are addressed. What do I do as a staffer on a committee? Well, my job is to make sure that the elected officials, who are the decision makers and deciders of all issues, have the information they need to have robust understanding of the issue, to have good debate, and to come forth with the best legislation, almost always in a bipartisan manner. You can see me there on one side of the screen with the chairman, Frank Pallone from New Jersey. If you take a little look, you can see a little look at me there in the back of the committee, the Dingle committee room during a markup of various meetings. And you'll see other staffers walking around as well. We're making sure that whether it's the debate decision points or the opening statements or the rebuttals are ready, that we're there to adjust and help the members come to the best decision they can. And when things go right, we get a chance then to go to the floor and have the same process happening on the floor. And it's said that everybody gets 15 minutes of fame. Well, that's my small 15 minutes of fame. I'm there staffing on the House of the Floor of Representatives in the United States Capitol on C-SPAN, being tweeted and retweeted. So that's my moment. What have I learned, in that process? Again, I mentioned sort of the wonderful immersion experience. What have I learned? Well, certainly as I was thinking and growing up in my professional career, and even my, work in doing some analysis and writing and things, I sort of had a vision of how policy was made. And I always thought of policy being very evidence-driven. And while you may have a slightly different schema or visualization of how you would do this, I sort of thought of things as a pyramid. You had a lot of information that people just thought, but as a profession, as a group, or even in my business aspects and things like that, what we thought was the real hard evidence, the really strong facts sort of rose to the top. And that's how we always wanted that to be at the forefront of everything we did. Things like influence and prioritizations and power that always influence this kind of stuff, but we really felt like, we were leading by evidence and fact. So I came to learn the political environment, and of course, one of the great things about our country is we're all equal voters and equal members of society. I recognize there are some challenges for some in that area as I say that, but it really a phenomenal country. And whether we're acting as individuals or in the groups that we belong to, whether it's our professional group or our business group or our advocacy group, we're all in this together and working evenly. And remarkably, sometimes all of us have a slightly different understanding of what the best fact is or how it fits together. And then, of course, it only complicates this by various influences and prioritizations and political influence. This should probably lead to a question about, well, how does policy then get done if there's so many opinions and so many different approaches to how things should happen? Well, the thing I've learned is that it's very important to pay attention to both the policy or the evidence and the facts, as well as the politics. When attention is provided to both of these, policy is made and good policy can be made. And I'm going to sort of show it in this table in a couple of ways. So first, I'm going to talk about the issue of access to healthcare. I think the science and the evidence behind the benefits of having access to health insurance are strong, whether it is for maternal and child health outcomes or early diagnosis, or even things like prevention of family bankruptcy and stress. Very strong evidence. But in the political world, there is a difference of opinion about whether this is a public or a private responsibility. Now, one way that we as a society, all of us in that multicolored diagram that I had earlier, has come together and said, well, we can find ways for public-private partnership to move this forward. So we have things like Medicare Advantage and managed Medicaid, and we have private insurance, but with subsidies for people to gain access on the marketplace. All of these have led to a way that more people are covered by health insurance today than ever before. Another area that I want to sort of show there in the bottom row there is coverage. So we know that we have a very robust therapeutic and diagnostic innovation. We lead the world in these areas, and we're coming together with medications and other things that are potentially just breaking ground, and then some advantages even when there's no other treatments. But this sometimes bumps up against competing budget priorities and concerns. So we have a number of things like coverage with evidence development that Medicare has had, and now recently, even this week, has even said we're going to make that a part of even more strengthen around that area to control costs. We have independent bodies that give advice in and around what Medicare should pay for. And then we also just recently began, or will begin in the near future, in the next couple of years, negotiation of Medicare prices, and a lot of questions about how this will go. Now, I know many of you on the audience here are looking at that column over there and say, Charlton, these are not solved. This is not even, I can't believe you're saying these are solutions. These are incremental solutions toward the way, and I agree there are many things that need to be fixed. But these are ways, by paying attention to both policy and the politics, that we've been able to move forward. Well, how can you be involved in policy? Well, if you've followed me along, and if the same light has gone off in your head that went off in my head through this process, you'll find that you are already involved in policy, whether passively or actively. So I'm going to try to do a few things to say, how can you be even more influential in that area? I think one thing to do is to make sure that you are curious and try to understand other people's objectives and their opinions. Now, this understanding each other doesn't always lead to compromise and common solutions. In fact, there's been many situations in which the more I've come to understand somebody, the more I objected to their opinions and had differences of opinion. But understanding is important in respect, and it's important in relationships, and it's really a big part of this process. It's also important for you to share your unique experience or perspectives, whatever that is. That helps other people understand you, and again, leads to that respect and ability to work together. I also encourage you to find those opportunities to volunteer or participate or join in associations. These are great ways of participating and having a voice in the system. And then finally, there are situations such as the formal fellowships and education and work opportunities. And of course, there's no better evidence of that than Dr. Shah here, of ways that you can use your knowledge and experience in influencing health policy. I just wanted to show a quick slide to show some of the other Robert Wood Johnson Foundation health policy alumni, fellow alumni who are there and representing both ASU and U of A in various positions. And some of you may know these professionals well. I want to leave just one parting reflection. So one of the in the east stairwell of the house wing of the Capitol, sort of hard to find and not on a normal tour, is this large painting. And I share it here not because it's anything of a great painting, but it's representing or attempts to represent the signing of the Constitution. And my experience now in working on the Hill gives me sort of a unique, or I should say, an appreciation, a better appreciation of what the Constitution does. These folks came together, and what I would say in speaking for them, they had their faults, they had their concerns, and great differences with each other in the room. But what they did that was so great is they said, despite these differences, somehow we're going to have to make some incremental progress and move forward. And the alternative is not as good as this difficult work of trying to work together. And for that reason, I just have a greater appreciation than ever before. Well, to wrap it up, I've had experience in this year, and I'm filled with gratitude, certainly to my wife and dog who packed up in boxes and spent this year on the road with me, the opportunity to see the country and some of the great sites. Certainly appreciation to the investment made in me by the Robert Wood Johnson Foundation, by the National Academy of Medicine, and by the committee for all their work with me. And I'm left with actually greater optimism about how the political process and evidence works together and can work together to create a better society. And if anything, I have a renewal of that commitment to that promise that I made to Mrs. Smith and Anthony that night so long ago. Thank you very much. And I will stop sharing and pass back to.
Thank you. Thank you so much, Dr. Wilson. What a wonderful presentation. I love it. And I really especially appreciate the comment that you made about all of us are already involved in policy and we can choose to get more involved and some great opportunities on how to do it. I love the painting as well. And I want to say from one dog lover now moving to the next dog lover and shepherded by another dog lover, I want to introduce Dr. Amish Shah. I mentioned Dr. Amish Shah's incredible history and progress of how he got to the Arizona House of Representatives. So with no further ado, I will pass it on to Dr. Shah. Dr. Shah?
Hi, Swapna, Dr. Wilson. Thank you so much for having me on this talk. I really loved the presentation from Dr. Wilson. I think you made so many points so well about the nature of the system and specifically how evidence plays a role within politics, and then also how that doesn't always drive policy, and there are a lot of challenges there. And I think you laid that out for people really well. So I really appreciated your talk. So my name is Amish. I'm a member of the Arizona House of Representatives. I'm an emergency physician. I still practice and have never stopped practicing. I graduated med school in 2001. I finished residency in emergency medicine in 2007. I was in New York at the time. I was a faculty member at the Mount Sinai School of Medicine, teaching resident students. I was doing peer-reviewed research. I have some publications. Finished in, was there 2012, but while I was there, worked for the National Football League. I was the guy on the side of the field with the red hat on in case something horrible happened. Worked with the league a little bit, got involved in sports medicine, did a sports medicine fellowship at the University of Arizona in Tucson, and then decided to do more, actually after that stayed in Arizona and did more community type of medicine, really rural medicine, learning all about emergency medicine across the state. While I was doing all this, I just started to feel a need to give back to the community. I got involved in more charity projects, animal charities, children's charities, and I saw how much impact it could make. And went to one political meeting and just wanted to be there to see what was going on in politics. In 2016, I kind of got drafted, and that was my story. And that's ended up running for office. Didn't really think that was ever going to be my path in life, it was just one of those things where I got interested, involved. It started to build, and I won in 2018, starting my first session in 2019. So I've done 4 sessions so far. In the middle of my 5th session, of course, I won re-election last year, my third election, excuse me. And it's been quite an educational experience being down here and understanding how health policy is made. So I sit on the Health and Human Services Committee. I am the ranking Democrat on that committee this year. I've served on that committee for 4 years. I also serve on other committees. I have regulatory affairs, ways and means, transportation, and this year appropriations, which is considered to be a very powerful committee as well. So we've certainly learned quite a lot about various different policy areas outside of health as well over these last few years. I've got this this all sort of happened, and I was an academic physician, so this topic specifically about evidence and about evidence affecting policy is kind of really close to my heart. I think that coming from that world of academic medicine specifically, you're trained to think about where is the evidence. I loved, my favorite parts of teaching residents and students was getting them through journal club and helping them understand this is, which articles are really well done, which ones aren't, and why, and sort of helping them form a sense of judgment around that to really guide them for the rest of their lives and their careers, and hopefully pass it on to further residents and students as how we actually learn to do things in medicine and care for our profession and make sure that we're sort of bringing the best level of evidence to our clinical care. Now, then you step out of that world and you go into the world of politics, and all of a sudden, as Dr. Wilson mentioned, it's like, whoa, it's a whole nother world. It's true that, in a randomized placebo-controlled double-blinded trial, we have a lot of control over what's going on there, and we get the best available level of evidence. And of course, not every study will be that. A lot of that will be on the other end of the scale, will be just expert opinion guideline or something, right? There's that range there. So you're dealing with a lot of imperfect information in life and in the world, and that is also. That's much more true in politics, because we don't do studies on everything and anything, and the amount of information and data with which politicians have to make their decisions is fairly limited, right? A lot of it is based on political argument, on rhetoric, and that has to you have to see how that all kind of influences policy on the other side. I'll tell you that I'm after being in this for around 4 years, I do think that evidence does sway lawmakers. It does sway politicians. People respond to facts and evidence, and they will be very sensitive to facts and evidence that come out that doesn't support their position, right? That doesn't mean that's going to stop somebody necessarily from doing something contrary to that. So I guess I want to say that on the in the grand scheme of things, it definitely has an influence that's there. I saw some of the questions in the chat, regarding this exact topic. So and at the same time, that's not going to be everything that moves a bill forward. A lot of it happens through the political process, and it's a little more nebulous than that. So I'll just leave it at that. I think you guys get my point. But nonetheless, for me, I'm saying that, and I think for a lot of the other representatives that are down here, politicians who do have maybe a healthcare background or some other background where they've been adjacent to this, I think that you start to see people really respond to that and use that as part of their duty as a public servant. So I think that that's been kind of my experience there, is that the more and more I can continue to bring these kinds of things to people, the more and more we build that. And for my part, I just, it's part of creating a culture in politics where politicians amongst ourselves will learn to respect that and move that forward. That has to come from people who respect this concept within the legislature or within Congress, and then continuing to spread that, so that, in my opinion, we become the kind of leaders that the people deserve, right? So that's kind of my journey through this. I could go off on, I mean, I have lots and lots and lots of examples, as Dr. Reddy knows, about the various bills that we've put forward that are evidence-based. Some, and it's using that framework to try to push policy forward. We've done it successfully over and over again. We've been quite successful and had some spectacular failures as well. So that's kind of the struggle that's down here consistently in the political world. I guess I'll stop there because I think that kind of covers where we wanted to go with this talk, and then I'll let Swapna decide where we're going to go next.
Well, thank you for handing me over that power of this fantastic panel. Thank you so much. It was a wonderful presentation, and thanks for giving us a little bit more background in your experience, and especially in thinking about evidence and how evidence can, should, sometimes doesn't influence the health policies that we create and implement. So what we might do right now, and we're actually running slightly ahead of time. And so I think Dr. Shah and I are generally not accused of ever running ahead of time. So this is a new experience for both of us, which is wonderful. But we have lots of questions in the Q&A, and it's really exciting. And I think a lot of really great questions. So let's just launch right into them. And I will just ask some questions, and then we can, either or both of our panelists can take them on if that works for you all. I'll start with Adam Thompson, who actually is one of our former students, who I know to be a current medical student at U of A Tucson. And so great to see you, Adam. All right, so here's Adam's question. What are some experiences medical students should seek out in order to set themselves up for a career integrating medical practice with health policy and advocacy? What are some career options for physicians who are interested in becoming involved in policy work? Really fantastic question. We have so many students I know that joined today that are either hoping to be physicians or other disciplines in healthcare and want to know how they can get involved. So love to hear from you all on that.
Should we just jump in, or
let's jump on in here? Yeah. Why don't we start with you, Dr. Shah?
So we get this question a lot. I think people feel sometimes that the political process can be a little unfamiliar to them, and sometimes it can even be intimidating, like you're stepping into a whole nother world, which you kind of are. The biggest things I talk about is that, number one, it's the level of interest. Showing up is 90% of the battle. Number two, you can have somebody help you. So a lot of the job of the organizations with which you work, whether it's the American Medical Student Association, we have an Emergency Medicine Residents Association, we have the Arizona Medical Association, the American Medical Association, all of these groups all have advocacy arms. They are there to help you get in touch with people like me and others, and they will get, you actually will strengthen your voice and give you access. They do great work, truly. And I didn't understand that when I was a medical student, a resident, or beyond, as to the value I was getting to the membership of these organizations. Truly, every dollar that goes into those membership dues that you're paying makes a huge difference for you. It really brings your voice to the table, and also helps make your life happy. I promise you that. We can talk about that much later. So I would say getting to those organizations, communicating your concerns, and having the power of the group behind you. Number two, look, as somebody who is a resident or citizen of the United States, this is the great thing about this. You have access to your politicians in a way that in many countries people don't have. People are, to my limited experience of 4 years in politics, I will tell you, we're very responsive to our constituents. We want to hear what they have to say. If you live in my district, you're my responsibility. No matter what party you belong to or what your viewpoint is, I do feel like my job is to listen. So there is a website that I talk about. It's called ballotready.org. If you type your address in there, it'll literally give you from Joe Biden to your dog catcher, everybody on down, and everybody that represents you. Your senators, your representatives, your county representative, whatever, all of it is in there. And so you can just look at that, and then usually their contact info is there. So it's a way for anybody to find any representative at any level and be able to contact with them. So you can do it on your own as well. But maintaining relationships with those lawmakers and politicians is where this all goes. How do you get involved? I mean, there's an ocean of work you could do or not do, right? And I think that's what makes people somewhat intimidated. But I say to people, these are the main ways in which I corral people to say, I want you to have a voice and have your voice be heard and be effective in advocating for your issue.
Great, thank you so much, Dr. Wilson.
That's just awesome. And I think the only thing I'm going to add is do so whether your interest is in basic science or in obstetrics and gynecology or in surgery. So wherever your professional interests lie, you also can find a really important way of contributing to policy as well, because in every single aspect of our professional and or healthcare career, and I was sort of focusing on physicians there, but with nursing, physician assistant, public health workers, community health workers, whatever your role is in the professional area, you will find similar opportunities to influence health policy.
Thank you so much. And we have another great question from Sahara. We have so many great questions, so it's hard to filter through these. But quick question here from Sahara. What are the challenges and obstacles, and I'll add in opportunities, of being either the only physician or one of the few physicians in the policy positions that you've had? And maybe we can start with Dr. Wilson this time.
Sure. Yeah. Well, I think the things that are important is how do we improve our ability of communicating very complex issues in a way that other people can understand. Now, if you think about it, when you say that way, or maybe when you start sitting there, you think, oh my goodness, I will never be able to understand all of the political, what is a committee, what people are working on, how do I do this? I just don't have those skills. But if you think about it, in health profession, whether you're a pharmacist or a physician or whatever you're ever doing, we're always communicating very complex information to someone else. Lean on those skills, learn what you've done to help people through their own personal health issues. Think of it as helping the country, an individual politician or a group or a committee, better understanding what's going on. And if you're finding that the communication isn't working, ask yourself, well, what is it that I need to do to sort of work on that? So a big portion of this, I guess, in more simple terms, is communication skills and learning how to share that information will help you be more effective, because I know it's in your heart and sometimes you just can't articulate it in a way that you want to or to be most effective. So keep honing those skills.
Dr. Shah?
Yeah, I have to, 100% agree with that. That's exactly spot on. So, lobbying is a skill. I mean, and lobbying isn't just for lobbyists, by the way. Lobbying is anytime you want to contact a member of the legislature and say to them, please vote this way on this bill. You just lobbied somebody, and we do it. Everybody does it all the time. So it is something that it can be improved upon, practice. So we have these groups, the American Medical Association. I know for us, ACEP is a huge lobbying presence on Capitol Hill, and they have these specific conferences that are called leadership, advocacy, or government. It's one of these acronyms, and so you go there, and they will take you on visits to Capitol Hill to lobby, and they'll teach you how to lobby and how to communicate those ideas effectively. I want people to realize, there are some like me. I mean, there's in the Arizona House and Senate, there's me, the only physician, there's 4 nurses right now, and then there's 1 EMT, and I think that rounds out all of the healthcare workers. So the other, there are 90 members. So the other 85 are not healthcare savvy. I mean, and that's okay. We need plumbers, farmers, and barbers, and everybody else in the legislature. So it can't just be made up of healthcare folks, but they're not going to have the expertise you do. So you're going to have to, talk to people about issues that might get complicated, might get into the weeds, but there's an art to that of breaking it down and getting it there, and to be able to, have an elevator pitch and to communicate that concisely, and also I'll say in a nice way. You always want to be very nice to people in this business. It really pays to be nice. The other way goes wrong right away. Whether it's, I think I know more than you, or I think, you should know that, or all that other stuff that can't be, it works really well if you strive to build relationships in this and communicate your position. Even if eventually that person decides to vote the other way, there's always tomorrow, and there's another vote that's coming. So it's the relationship that's important, not just that you got your way right now. And I think those are some of the things that I would use as advice to people, and would give as advice to people.
And just to follow along that, your comment there about the timeframes that occur in a political process are much longer than perhaps we expect in a clinical or in even a business process. And certainly some of the work that I did with the professional staff certainly had very often weeks of work, sometimes months, and not uncommonly years of work that led up to a piece of legislation now being discussed or debated on the floor. So definitely it's a long game, but it's incremental progress along the way. And I really appreciate that comment.
Lots of good life advice there, by the way, not just in the policy sphere, but life sphere. We've had a couple of questions also here, and also by my students in the class that I just taught before I came over here. How do you actually balance being a physician and getting involved in policy work, whether that's actually joining, say, a state legislature, or joining Congress, or getting in, or taking time to do something like the RWJF policy fellowship, or just getting involved with the type of advocacy and lobbying work that you both mentioned? How do you actually balance both of those in a realistic way? We'll start with you, Dr. Wilson, because I feel like you're smiling and have something.
Oh, okay. Well, I thought this was teed up great for Dr. Shah there, but I will. So here's what I did over my life. I would be very involved in clinic, and then I would find myself on a committee, and then I'd be struggling to try to keep everything in balance. And then I'd say, okay, no more committees, no more anything. I'm going right back to the clinic. I've got work to do. I went through this multiple times in my life, and eventually I found out that no matter how hard I tried, I'm going to wind up on a committee somewhere working on some things. And so I found those ways to say, well, what do I need to do to commit to being my very best in that area that I want to influence on? So for me, what I did is I have, yes, and I know many people, and Dr. Shah is going to show how he does it, people who can balance both. I took an approach to say, along my long career, and I have had a long career, along my long career, there's a time and became a time in my career where I shifted from one set of skills to a separate set of skills. So that's how I did it.
Great, thank you. And Dr. Shah.
So I get this question a lot, and I work a lot. I mean, I'm not going to lie about it. It's during the time session is ongoing like it is now. I mean, I actually have committee in about 15 minutes. It's 80, 90, 100-hour weeks. So that sense of balance is something you have to weigh against everything else that goes on. It really helps to have a very patient and an extremely supportive girlfriend. And I'm very lucky for that. I think that you take on a lot doing this. So the practice of medicine is, whatever it is, that's one full-time job that I have. I currently work at Mayo Clinic in the emergency department there, as well as some also Dignity Health at some of the other ERs. This place, which, I mean, it really is 24/7, 365. I mean, once you're elected, you're on. That's it. And then there's also the campaign aspect of it. So every politician also must run a campaign at the exact same time, and that's a continuous process. So you're dealing with a lot. That balance is for every individual to strike up. I'll just say what keeps me going, besides doing all the life stuff, right? Like work out, eat right, et cetera, take care of yourself, leave time for yourself, all that other stuff. Besides that is that there is some amount of true passion that I have for this, and that I think once I got in for the first time and I started to see that you could actually make a difference doing what you're doing, I think that feeling is addictive. I think that are not elected, for example, heavily involved in the process, such as my board members at ASAP and at ARMA, when they toil away at this stuff and they can see the fruits of their labor, that they've truly helped physicians, they've helped patients, they've helped nurses, they've helped all of society in building something better. I think that brings you energy and brings you joy, and so that I think can also for some of us kind of drives us, gets us up in the morning, and I'll say, like, I've enjoyed it in that sense. There's a lot that you have to do to put up with, just like the practice of medicine. There's a lot you have to put up with, but when you get to a patient and you really make a difference in their lives, either by holding their hand or doing something technical to save their life, those are the moments that keep you going through it. So that's my 2 cents.
Yeah, absolutely. We have a couple of questions also asking about how you sort of navigate trying to influence policy with evidence and research, but also running up against this other reality, which is politics, also different philosophies, religious beliefs, et cetera, especially in what feels like a fairly polarized climate. What do you think is the best strategy, and what advice would you give for either future health professionals or current health professionals that want to get involved but are a little intimidated by that space?
Do you want me to take that, or Dr. Wilson?
Yeah. Okay. Well, either way, Dr. Shah, why don't you start?
So, it's a long game. I think that the work that we have to do here has to involve the people. That's part of what we also as healthcare professionals have to understand. The word doctor comes from teacher, right? And our job is to educate about illness. Sometimes what can happen, and there's the appearance that what politicians or maybe physicians or others in the healthcare spaces are perhaps trying to dictate policy. What I would really rather do is try to explain it as best as possible, and try to make sure that everybody gets on board with understanding why we're doing it and what exactly is going on with it. And I think that is important to get yourself as much buy-in as possible, including in a bipartisan way. So one of the things that over the last 4 years I've really managed to do is build a lot of relationships with I'm a Democrat. I've countless Republican friends now down here, and I'm always willing to approach even the ones that never seem to have like very diametrically opposed worldviews, but always continue to engage them in conversation on a particular issue, and just never really make it about the person, but make it about the policy. And that approach continues to bear fruit, right? And in terms of people feeling that, hey, look, I may not agree, but I was included in the conversation. I may not agree, but I can see where that person's coming from. And so it's a very long game. The process is partisan, and yet there are many avenues to try to break through that. It's not everything that the media paints it out to be on television. There is a lot going on behind the scenes of people trying to truly work these things out for the sake of the people. We're here as public servants to serve our populations and solve problems. Most of the people down here have not forgotten that. And I really I like working with all of my colleagues, because they do to some degree or another, respond to that. So I think that's kind of how you have to approach all of it. It's a long game. Continue to work with people. Continue if somebody's doing something anti-science, for example, as you see it, then you have to be able to continue to have those difficult conversations. There's a quote I heard, I'll end with this. The quote I heard was, somebody's success in life is directly proportional to the number of difficult conversations they're willing to have with other people.
Wow, fantastic. And I just share what I heard there as well, which is it's actually a very professional environment, is my experience. People do talk civilly to each other. There's that opportunity to share these ideas. Certainly, sometimes we have differences, very strongly held differences of opinion. But if you've created the relationship, if you're able to speak through the issues, not to make it too mechanicalistically or too mechanical or whatever the right word there is, but to say, am I issuing and having a discussion in and around some policy or evidence issue? And therefore, there's where as a physician, maybe my first natural ability is to say, oh yeah, well, here's how I would have discussed it at Journal Club, or here's how I would have better presented that on a chart. And I'm going to draw a new chart to make my point a little bit better. But also to be able to think, maybe this is a discussion in and around political difference. There might be a political objective that this interferes with. How do I understand that? I need to understand that in order to understand why the person I'm speaking with is maybe acting or reacting in a way that I think is contrary to what I'm doing. And if I understand it, I still may not agree with it, but at least I understand that process, and I can work and begin to set another set of strategies to help work through that. Because maybe there's a different political approach that's necessary. Maybe there's political relationships to build, or there are some other agencies that need to be brought in, or stakeholders need to be brought in order to make a political statement. It's not my evidence statement here that I need to make stronger. It's the political position. So great points.
I think I have one final thought on that too. After listening to Dr. Wilson, I think that it's a kind of a reflection on our current age, where what I see a lot is people walking in to a conversation without true openness and saying, I already know the answer and I'm going to convince you of why I'm right and you're wrong. That doesn't usually work. It's really better to reflect on whether you're going into any conversation with the ability to listen just as much as you want to be heard. And if you're going in there with the agenda saying you're going to do this, or I'm going to make you think that, or you're usually not going to be successful with anybody. I mean, that's just besides, but it's especially true in politics. And of course we have opinions. I mean, we wouldn't be in politics if we didn't have opinions. Everybody has one. Every citizen has one. Every politician. And so be willing to have humility. I mean, I think that's the biggest thing that I was taught in emergency medicine residency that you may not know. And to be able to walk into that space also gives the other person the authentic impression that you are willing to meet them where they are, to listen in a space without prejudgment. I think that has been a really big thing that came from my medicine training that I was able to take forward into politics.
Oh, well said. Well said. And again, lots of great life advice, not just advice on how to get involved in policy today. I'm going to ask you a lightning round question now. Okay. So we have to answer it lightning fast because we're running out of time, even though we have so many great questions. How do folks that want to get more informed, that want to get more involved, where do they go to find out more information, to stay informed on the issues, whether it's local, state, national? How do we find out? That seems to be a real challenge on a regular basis. How do we stay informed as citizens, and especially folks that might want to get involved in policy? Okay, lightning round answer. Go for it, Dr. Wilson.
I sign up for various blogs and emails, and particularly things like the Kaiser Family Foundation gives a broad email every morning with more than you can read.
Perfect answer. I use that as well. All right, Dr. Shah.
I just go to Twitter and I don't look at anything else. I'm just totally kidding. So no, please stay off the internet and with regard to the social media, with regard to this kind of stuff. It isn't often helpful, I find, and it's quite frankly the opposite of that a lot. It would be great for you to talk to people through these professional organizations who will give you some sense and some context. I like reputable traditional journalistic sources, so I read the Arizona Republic. It's important. The local news is in there. Real journalists, it's a profession that is supposed to report what's going on. Yes, and of course I read national newspapers. There are some that are right-leaning and left-leaning that are like New York Times and the Wall Street Journal actually do have journalistic standards, and I think those are important to at least to consider as sources, right? But then there's other sources. If you really want to get into it, there's the Arizona Capitol Times and the Hill, right? If you really want to know what's going on, like to the detail level within politics, those are your sources, which it's a lot of inside baseball, but it's there. And so you can, it's much more transparent than you think. So the information is out there, whether it's policy information or political information, it's out there. I think that, again, as people in the healthcare space, we are actually pretty attuned to trying to separate out, am I getting fact or am I getting someone's opinion, right? And is there bias in this? It's the challenge of our age. We're in the information age and we're being inundated with information. And of course, that's presented a lot of challenge that humanity has never faced before.
Yeah, absolutely. Well said. Thank you so much for those pointers. We could go on and have this conversation for the rest of the day, but unfortunately, that's all we have time for today. We want to encourage everyone that joined us. We had over 100 folks joining us today, so thank you so much. We encourage you to follow the College of Health Solutions on social media. Social media channels are on your screen and in the emails you've received about this event so that you can learn about other opportunities like this one. Our Health Talk series will continue next month with Here Now, Innovations in Speech and Hearing Science. Just a quick reminder that March 16th at noon event will not be eligible for continuing education credit. And again, it's March 16th, so please join us. But please join us every month for conversations just as compelling and important as this one. Thank you so much, Dr. Wilson and Dr. Shah, for joining us today, sharing your incredible experience and your wonderful insight. Thank you also for everything that you've done in the policy world and for contributing evidence, research, and science into our public sphere. Thank you again, and have a great rest of your day. Bye-bye.